Hi, I'm Jane Turner. I am a pediatrician, now retired faculty in the Department of Pediatrics and Human Development at Michigan State, and I am co-director of Michigan Lend. I wanted to provide a little bit of background information about a very important program for children who have special health care needs, and that's Children's Special Health Care Services program. And this is part of a wider system of care that's in which children receive their care. And it's relevant to this particular module because you're learning about a number of different health conditions, many of which the children would be eligible for coverage through Children's Special Health Care Services. So a little bit about it. This is just a statement taken right off of their the web page of the Department of Health and Human Services. That it's a program for provides comprehensive support for children and some adults who have special health care needs. And it covers about 2,600 medical diagnoses. And here is a link to the description on the Michigan Department of Health and Human Services webpage. So the key features, one, as I said, it's in MDHHS. It assists children, youth, and adults with special health care needs. And here's what it provides. It really provides financial support by providing coverage, referrals, and support to families, pays deductibles, co-pays, and in some cases will cover insurance premiums so children can stay on another insurance that covers the costs. The program also helps with transportation and lodging if the family must travel for care. So let's say a child lives in Traverse City and needs to go to the University of Michigan for a subspecialty care. Some of the cost of travel would be covered. And it also supports care out of the state, out of Michigan, if the care is not, if there's some subspecialty care, some special expert elsewhere that we just don't have in Michigan. So it really provides a lot of support for kids and some adults. There's also the family-centered services and the family center. You've already learned about the family center, and we have members, leaders, and staff from the family center working on my lens. So I won't go over this in detail, but the family center resides within Children's Special Healthcare Services. One thing that's important to know is that children and families are eligible for services from the family center, even if the child is not enrolled in Children's Special Healthcare Services. So you do not have to be enrolled in the program to tap into the resources of the family center. So who's eligible? So these are infants, children, youth, and some adults, and I'll go over that, who have significant health conditions. They're eligible through age 25, so eligibility ends at the 26th birthday, except for 3 specific diagnoses. There are 2,600 medical diagnoses on the list. The condition must be chronic. And so either the child has to have had the condition for a certain number of months, or it's likely to have at the onset. So for instance, if a child is diagnosed with diabetes, you don't have to log in a certain number of months to show that it's chronic. We know that diabetes is going to be a chronic condition. And also subspecialty care must be necessary. So for instance, asthma is on the list of diagnoses. Many, many children have asthma. Most children with asthma, their asthma can be managed by their primary care provider, and they do not need to see a specialist. Children, only those that need the care of a specialist would be eligible for Children's Special Health Care Services. Coverage. Some conditions are definitely not covered, and I wanted to make sure we go over this with this group of MyLend trainees because many of the children and youth that you will be seeing have high needs, but their conditions are not covered. And those are behavioral, developmental, and emotional conditions. And this is because of the legacy of the program, how it was started, and the budgeting. It's just not budgeted to cover all of that. Developmental, behavioral, and emotional conditions are supposed to be covered through a different administration, a different program through community mental health. rather than children's special health care services. Subspecialty care is covered, but not primary care. Only care for the eligible condition is covered. So, for instance, if a child is enrolled in children's special health care services for the diagnosis of epilepsy, all care related to the epilepsy would be paid for. But let's say that a child has an earache and needs to go to urgent care on a Saturday night and is diagnosed with an ear infection. It's not related to the epilepsy, and that bill would not be covered by children's special health care services. About 2/3 of the children and youth enrolled in children's special health care services are also enrolled in Medicaid, or some are in My Child. These children are automatically enrolled in CSHCS, and all services are covered, including primary care services, because that's part of the package, the bundle of services covered by Medicaid. Wanted to talk about a couple of recent additions, and this kind of brings us to some of the ideas of advocacy and making changes and making things better. Just very recently in 2021, a third condition was added to those that are covered lifetime. Prior to 2021, the only conditions that were covered for adults were clotting disorders, i.e. hemophilia, and cystic fibrosis. But in 2021, sickle cell disease was added for lifetime coverage. As in the children, the coverage is for care related to this condition, not all care. Another big change, and this was in 2023, is that the coverage was, the eligibility was expanded till the 26th birthday. So as of about a year ago, the stats showed that over 5,000 young adults, more than 21, were now enrolled, a big jump. 1,200 are the Title V only, meaning they do not also have Medicaid. They have only either commercial insurance or no insurance and children's special health care services. 1,200 who did not have the Medicaid coverage. And to put that into the context of how big the program is, overall, CSHCS enrolls about 42,000. So an additional 5,000 is a pretty big jump. And this is a big thing for young adults. And it's very important because this age between 21 and 26 is quite a vulnerable age as young people make the transition from pediatric care, a pediatric model of care, to an adult model of care. And a lot of kids, a lot of young adults fell through the cracks. And we could see that in the data showing an uptick in emergency room visits rather than getting the care that they need from their specialists. So what are the implications for the children and youth that we're talking about at Myland? That is, those with autism and other neurodevelopmental disabilities. So one big thing to remember, and this is frustrating, but it is important to know, developmental and behavioral health services are not covered. However, many children with neurodevelopmental disabilities also have medical conditions that are covered. So they have co-occurring conditions such as epilepsy, cerebral palsy. They have heart conditions or respiratory conditions or deafness. Children who are hard of hearing or deaf are covered, and the coverage is extensive, including hearing aids and cochlear implants if that is appropriate for the child. So again, many of the children and youth you will be seeing will be eligible for and maybe getting support from children's special health care services because of co-occurring medical conditions. Summary, it's really CSHCS, an important resource for families. It's good that we know about it. Developmental and behavioral conditions are not covered. Sorry to keep repeating that, but it's an important thing to note. And the Family Center is a resource for all families with a child with special health care needs. They don't have to be eligible for or enrolled in children's special health care services. So that's my little spiel to give you a little background about children's special health care services. We can talk about it during our face-to-face meeting or on some Zoom sessions in the future. Thanks.